Hi, my name is Jamie. I'm going to be doing the practice video on medication administration for the two medications, the PO medication and the IM injection. So I'm going to start out with the patient administration rights, which are the the six rights, which is the right patient, the right medication, the right route, the right dose, the right time, and the right documentation. So I am going to access the medical order, which is the MAR. I'm going to make sure that it's the right patient, which is Millie Larson, the date of birth, and the two medications. So the Doxysate 100 mg tablet, which is given oral, and it is due now, and it is to soften stools. The second medication is the haloperidol, which is the 2 mg. It's the IM injection, and it's due now as well, and it's for control of agitation. So what I'm going to do now is just make sure that Millie Larson does not have any allergies. So check the MAR. She does not. She has no known allergies. Perform hand hygiene. I'm going to gather all my supplies. So the pill cups, the water, the right syringe with the needle. So the syringe that I'm using is the 3 ml syringe. And the needle I'm going to be using is the 22 gauge 1.5 inch needle, which the expiration is good. It's 2/28/2026, which is good. So I am going to put that to the side. I'm going to grab the alcohol pad, clean gloves, and I'm going to hand hygiene again, verify the medication, the MAR, against the medication I'm going to grab. I'm going to grab the Doxysate and make sure it's Doxysate. It's 100 mg, which I'm going to verify against the MAR record. And the expiration is 6/2024, which is good. I'm going to put that to the side. Verify it again. And then I'm going to grab the vial for the haloperidol. And I noticed that the vial is a multi-use vial. It is a 5 mg ml vial, so it's a multi-use. So we only need 2 mg IM for the haloperidol. So with the calculations, the medication that needs to be administered is only 0.4 ml. So I'm going to draw up 0.4 ml on here. So I'm going to also make sure that the expiration is good. It's 6/2029, which is good. Verify it against the MAR again. Verified it more than 3 times, which is good. And I'm going to prepare the medication in the medication cup. I'm going to perform hand hygiene first. Pop this medication into the medication cup. And I'm not going to touch the, make sure I don't touch the medication itself. I'm going to put this to the side along with the glass of water for the patient. I am going to open up the syringe, make sure I don't touch the top of it. And I'm going to open up the needle and make sure I'm opening it up in a way that I'm not touching the top of it. I'm going to screw it in. Okay. I'm going to draw up some air, 0.4 air in the syringe. I'm going to clean the top of this vial with an alcohol swab. Make sure it's clean. I'm going to inject the air into the vial. and draw up the needed amount, which is 0.4. I'm going to make sure there's no air bubbles. Okay. And in a one-handed technique, I'm going to recap this needle without using a one-handed technique. Recap the needle. I would either do this or I would change the needle. So one-handed technique, I'm gonna label this injection that I'm gonna give with the name of the medication, which is haloperidol, and that's the 0.4 ml. I'm gonna place this multi-use vial back in the medicine cabinet. I'm going to bring all the needed supplies into the patient's room. But before that, I'm going to provide privacy. I'm going to knock on the door. I'm going to identify the patient using the name, make sure she's Millie Larson, and date of birth. I'm going to check her wristband, as well as asking the patient to verbalize the name and date of birth. So Millie Larson, date of birth is 1/1/1936. I'm going to also verify it with her MAR records. Verify the medication again. I'm going to explain the procedure to the patient. Just let her know that she's going to be getting a oral medication as well as an injection today. Give her some privacy. And I'm going to first administer, give the patient the oral medication. Give her the cup and some water. Make sure she actually drinks and swallows the medication. Put her in a sitting position, like so high Fowler's position when I'm giving this medication. Then after that, I'm going to give her injection. So I'm going to be putting the injection on her left hip. So I'm going to only expose that left hip. Provide privacy again for the patient. Drape only that portion of the leg. Ask her to lie on her left side with her right leg straight. Locate the greater trochanter, anterior superior iliac spine, and the iliac crest. I'm going to place the palm on the greater trochanter and index on the anterior superior iliac spine. And the middle finger is going to be pointed at the iliac crest. I'm going to use my left hand on her right hip like this. Create a triangle. And in the middle of the triangle is where I'm going to do the injection. So just let her know, make sure that the landmarks are correct for the injection. Once I identify the landmark, I'm going to put on clean gloves. Okay. I'm going to clean the area with an alcohol wipe. So I'm going to use this orange. I'm going to clean in a circular motion outwards. Okay. Let the site dry. And I'm going to have everything by my side. I'm going to have the medication along with the Band-Aid, gauze, and the injection itself. I'm going to, with my non-dominant hand, I'm going to hold the skin very taut by spreading it from the center outwards. Like that. I'm going to insert this needle. I'm going to open it up. I'm going to insert it on a 90-degree angle. So like this. And I'm going to hold, stabilize the needle. And I'm going to aspirate back the plunger for 3 to 5 seconds. And if there's no blood return, which there's no blood return, I'm going to inject the medication like this. And then I'm going to remove the needle smoothly, engage the safety device, dispose the needle in the sharps container, and I'm going to put some gauze on the site. Hold it there for a few seconds, put a Band-Aid on, remove my gloves, perform hand hygiene. I'm going to place the patient in the lowest position for the bed. Make sure she has the call bell light, and go back to the MAR records. Indicate that the medications were given and how they were given, so PO. And also the injection was given on the right ventrogluteal. I'm going to indicate that as well. And that's it.